Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just joining us, we are talking about kidney stones, how to treat them and how to prevent them. Let's get to some of our viewer questions. But first, we wanted to talk a little bit, we were talking during the break about the sizes of how big these things can get.
Yeah.
I mean, we're normally about a centimeter, but those are pretty big.
Yeah, if it's less than 1 centimeter, that's sort of like 2 pencil head tips. You'll be able to pass that on your own, usually with hydration. If not, they have to go in from the bottom end and with a little basket and grab it and pull it out. If it's bigger than 1 centimeter, then the stone needs to be broken, and that's done with a machine called lithotripsy. Basically, it means break up stones, and they put you in a machine that's actually an ultrasound machine. They shake it really, really hard, and that stone will bust up and make itself into many, many smaller stones, and then those stones can pass. But we were talking about the size of them. They can get huge. They can get the size of your actual kidney. Those are called staghorn calculi. They're just massively huge, this big, and you actually have to have surgery to remove most of the kidney along with the stone. So it can be extremely severe, but most stones are less than 1 centimeter, and they will pass on their own by just staying hydrated.
All right, so now Jackie from Manilo asks, are there natural remedies to get rid of my kidney stones?
Well, we were just talking. So if you have small stones, your best natural remedy is water. You can take a little Motrin that will help the inflammation that happens around the stone, allow that pain to relieve itself a bit, and help the swelling go down so the stone can pass more easily. Of course, cranberry juice might help bacteria not stick to it as well. So lots and lots of water and hydration.
Okay, Mark from Manilo asks, if I've had kidney stones before, we did mention this, am I more likely to get them again?
You certainly are, and if you've had one before, you know what it's like, and you'll be much more careful in the future to be hydrated and to avoid the factors that might be aggravating in you, especially if you suffer from gout also.
Okay, Rachel from Totu asks, my mom says I can get kidney stones from drinking too much tea and soda. Is this true?
It is true, because that brings your oxalate levels up higher in your bloodstream. Then that has to get filtered, and you're much more likely. In addition, soda and coffee and tea are dehydrating in their own right. So just by drinking those liquids, you're actually dehydrating yourself. So you need to drink more water after your tea or coffee.
So, and in addition to that, I mean, we hear about like thirst quenchers, like Gatorade, and all these sports drinks. Do you suggest those?
Water really is the best. If you're, an extreme athlete and you're sweating out a lot of electrolytes, then you can replenish with something like Gatorade. But if you're just a regular person inside, just drink water.
Okay. Frank from Dedado asks, if I have blood in my urine, does that mean I have kidney stones, or could it be something more serious?
It could certainly be more serious. Kidney stones sometimes will be silent, and you will just have a little bit of blood in the urine. Sometimes it's even microscopic. You can't even see it, but we can dip it and see if there's blood. But certainly if you're a smoker, you could have bladder cancer or even kidney cancer, sometimes prostate problems in men also. So there are several other things to consider if there's blood in your urine, but if there's red blood in your urine, definitely get checked.
Okay. May from Jontya asks, is it possible to have kidney stones and a UTI, that is a urinary tract infection, at the same time?
It really is, because that kidney stone is a foreign body in your system. It's really just something that's sitting there waiting to get infected, and germs can actually go and hang around on the stone and cause severe kidney infections, not just bladder infections, but kidney infections that damage and destroy your kidney. So yes, you can have both, and it's important to have them treated.
Okay, and our last question comes from Vic from Barragata. What does a stone look like, so I will know when it passes, or would you even know?
Would you even know? Great question. If it's teeny weeny, you might never see it. So here's a trick. You can get a regular coffee filter, and when you're urinating, urinate your stream through that filter, and your coffee filter will catch the stones if they're large enough than a very small little fragment, and you can see them in there. And actually, you can take them then to the lab and have them analyzed, and they can tell us what kind of stone is this. So we can tell you, look, this is the kind of stone you have. These are the things you need to do to prevent. So filtering your urine through a regular coffee filter may be very helpful if you're a stone sufferer.
Okay, any other last tips that you want people to know about kidney stones too? I mean, prevention is obviously key. Drink, hydrate, lots of water. But any other Any other advice?
I would just say, Mindy, that on Guam we have a huge burden of kidney disease because of our diabetes and high blood pressure that people suffer from here. Plus there are several other diseases that are very common here on Guam, damaging people's kidneys. So the last thing you need is one more thing to hurt your kidneys. And I think if you're aware of stones in your urine, or just aware that this could form, you'll be more likely to get a once-a-year urine checkup as part of your annual health exam, and just check the health of your kidneys and your urine.
And one last thing I forgot to ask is, how would you know if you have it? I mean, sometimes it goes symptomless for a while, right? You won't necessarily have blood in your urine.
You wouldn't see the blood. It's microscopic. So it can be silent, and that's why I say if you get it checked up at least once a year, you'll find out that you have problems before you actually feel the problem.
And that's the pain in the side that you're going to feel.
Severe.
Yeah. All right, sounds good. Thanks, Doc. So remember to stay hydrated and drink lots of water to help prevent kidney stones. Dr. Lom will be back again next week to talk about skin and aging. Send your questions to healthyliving@kuam.com, or you can post your question on our Facebook page, or of course on our website. There is more healthy living still to come. Stay with us.